Hello, my name is Adam Wright and this is my research proposal presentation. My topic of choice falls into the realm of physiotherapy and it involves the effects of dry needling on muscular pain and injury. Having been involved in sport all my life, I've grown accustomed to the odd injury or two and have discovered a great interest in physiotherapy and the treatments that they can provide. Muscular pain and injuries have always been a part of sport and athletes are constantly looking for different methods to speed up the recovery time so that they can get back to playing and competing as soon as possible. Muscular pain, which can be referred to as myofascial pain, is often associated with myofascial trigger points. The myofascial trigger point is located in a taut band of skeletal muscle fibers and they are extremely irritable to touch. Dry needling involves the insertion of needles into tender points in the body without the injection of any substance. These tender points are the myofascial trigger points. The tiny needle point that is inserted into a myofascial trigger point during the process of dry needling causes a high amount of pressure to the point and this can cause referred pain and a local twitch response. Referred pain is when the patient feels pain at another site other than at the site of the needling. Obtaining a local twitch response when dry needling is critical due to the rapid depolarization of muscle fibers that occurs and thus creates these muscle twitches. When the muscle stops twitching, there should be an immediate relief in pain and dysfunction of the targeted muscle. It is believed that dry needling affects the biochemical environment and the local blood flow surrounding the myofascial trigger point being needled. A single session of dry needling increases blood flow and oxygen saturation around the myofascial trigger point for at least 15 minutes after needling. It is suggested that increasing blood flow to the area of injury may aid in the removal of pain-inducing substances. Past studies. I conducted a search on past studies involving dry needling to treat muscular pain and injuries. 5 studies were found that met the criteria I was looking for. They were Cotchett and Co., Sy and Co., Huguenin and Co., Fernandez-Canero and Co., and Osborne and Gatt. All 5 of these studies investigated the effects of a dry needling intervention on their respective muscle groups in terms of pain reduction and muscle functionality. 3 out of the 5 studies showed substantially improved results as a result of dry needling. Fernandez-Canero and Co. and Sy and Co. both found significant decreases in pain in their respective intervention groups as opposed to their sham needling control groups. Similarly, there were better improvements for both studies in their range of motion for their respective muscle groups in their intervention groups compared to their control groups. Similarly, Osborne and Gatt found improvements in pain reduction and in range of motion testing amongst their 4 participants. Cotchett and Co. discovered statistical improvement in the intervention group compared to the control group in regards to pain level, but not at any significant level. Whereas Huguenin and Co. found that both their intervention group and their control group improved in most areas at the same level with no perceived advantage to the dry needling intervention group. As can be seen by the results of these studies, dry needling as a treatment method for muscular pain and injury is predominantly successful and effective. Limitations. The 5 studies mentioned went a long way to proving that dry needling is an effective treatment method for muscular pain and injury. In saying that though, there were a couple of similar limitations that arose from the studies. The most common limitation was that these studies only looked at the immediate effects of dry needling on the body and that there was a need for future research to look at the long-term effects and possible benefits of a dry needling treatment. This limitation leads me to my proposed research question, which will hopefully produce some of the answers to this limitation. My question is, what are the effects of dry needling treatment on long-term injury recurrence in the lower back? I intend to break this question into a primary and secondary question. The primary question will be to determine if there are any positive outcomes from a dry needling intervention in regards to long-term injury recurrence in the lower back. The secondary question will look to confirm the data that was found from the past studies with reference to the immediate effects of the dry needling intervention on lower back pain. General methodologies and timeline of study. To answer these questions, I propose a partnership between myself and a private practice physiotherapy clinic called Spectrum Healthcare based in North Ryde in Sydney. With the clinic's permission, I will gain access to patients who present with lower back pain and other injuries associated with the lower back. If patients meet this criteria, they will be asked to take part in this study, and consent will be obtained in writing if they agree. Each patient will receive a dry needling treatment to their injured area in the lower back, and this will be performed by a fully licensed and trained physiotherapist with years of experience performing dry needling. It will be suggested that each patient receives a total of 3 dry needling sessions in the first 2 weeks, although this will be subject to patient availability and the severity of their pain or injury. The results will be obtained in a qualitative manner, with each participant filling out a McGill pain questionnaire immediately before and after each dry needling session. The McGill questionnaire is an example of a self-reporting pain test to determine each participant's pain levels before and after the dry needling treatment. Past studies have used this questionnaire and have stated that it is a valid way to measure the effectiveness of a treatment on pain and injury reduction. This process will allow me to answer my secondary question that I proposed earlier. In addition to this, each participant will receive a follow-up phone call from myself 1 month after the initial treatment, 3 months after, and 6 months after. I will ask the participant to complete a McGill questionnaire again over the phone each time to determine their pain levels. As well as answering the survey, additional questions will be asked to determine if any instances of severe pain or injury recurrence have occurred since their initial dry needling session. These phone calls will allow me to answer my primary question. Hypothesis. I hypothesize that there will be positive results for both my primary and secondary questions. As previously mentioned, past research has shown that dry needling has positive immediate effects, and I believe that these will translate over to long-term positive effects as well, in regards to less injury recurrence. Resources and funding. Spectrum Healthcare will be my primary resource and point of contact to obtain participants for the study. In addition to this, their physios will administer the dry needling treatment. There will be no foreseeable costs involved, as I have a pre-existing relationship with the clinic, and they have already given me permission to use their facilities and their staff to access what I require. I believe that this study will help to fill the gap in literature in regards to the long-term benefits and effects of dry needling on muscular pain and injury, and I hope to receive the chance to go ahead with this research project. I apologise that I was not able to make it down to Canberra in person to present this proposal, but please pass on any questions or queries that you may have, and I will answer them accordingly. This is my reference list. Thank you for your attention.